Hi, my name is Nicole Gipson, and I work at Cleveland Clinic Children's in occupational therapy. And I'm here to present today's topic for the virtual education series called Picky Eating. And we're going to talk quite a bit today on a few different aspects of picky eating and hopefully kind of clarify the difference between problematic feeding and what is just your classic picky eating. And I'm going to share my screen right now and try to start the slideshow up. And hopefully you can follow along with me today and just kind of get to know a little bit more about picky eating. I will tell you my information at the end of the slideshow if you feel the need to ask questions, as this is a recorded webinar. So, as I mentioned before, I'm an occupational therapist. What is occupational therapy? We typically address all the daily occupations of the infant and the child, and you may think of that as occupation definition as work, when truly what babies and kids are doing throughout the day, what occupies their time, is eating, sleeping, exploring their environment, and playing. So that's how we come in as a therapist for picky eating. There are lots of different things we assess when we look at eating when a child comes in for an evaluation, but we tend to have some specialists that can serve kiddos that are a little bit more involved. And then we do have picky eaters that we see that we're kind of treating for becoming on the verge of being problematic or restrictive eaters, or maybe they're already there. But for the purposes of today, what is picky eating? Picky eating is having a limited food variety, strong food preferences, or avoidance of new foods that persists over time. It's sometimes related to sensory processing, which OTs deal with a lot in other areas as well. Sometimes it's how we move our mouth, so our motor control of our oral muscles. And sometimes it can be behavioral difficulties like coming to the table, having a hard time sitting down, yelling, screaming no, or pushing back on our family when we do present new foods. And sometimes it's all three of these things. So we really need to tease out what is going on with some of these picky eaters. When we have picky eating, sometimes the nerve pathways in the brain that communicate with each other just are not complex enough to process those new textures and flavors, as food is really complicated. It's wet, it's smelly, it's squishy. Sometimes there's juice in it. Sometimes there's two different textures that we're trying to process at the same time. And so over time, our brain can desensitize to those aspects if we are exposed over and over and over again. And so we need to do that. We need to have those exposures so that our brain pathways can become more complex so that we can understand, I'm having a soup and it's wet and it's squishy. And this is how I move it around and process it in my mouth and tolerate it. But before we really get into picky eating and some problematic feeding, we're going to talk about a couple myths that you may hear in regards to picky eating about children. A lot of people, when you complain about this to your pediatrician or maybe to a friend or a relative, may say, don't worry about it. They'll eat when they're hungry. And that's not always necessarily true. And so we'll go into some of those things red flags you want to look for if you do have a picky eater. We want to make sure that everyone knows that it's not always easy. It's not always easy for every child to just show up and be able to eat a piece of pizza. They might not have those movement skills in their mouth to be able to chew and swallow. It's also not the parent's fault. I think we're all guilty of having a niece or a nephew or a friend or a family member or a neighbor that we may think like, oh man, if they would just push them more or present them more or present the food more often, maybe they would actually eat it. But really, what's happening under wraps in someone else's house might not be the case. They may have addressed it, and we don't want to make that judgment on the parent. We also don't want to make that judgment on ourselves and make us, as parents, feel like it's our fault because we've never presented it or we haven't tried hard enough, because that's just setting ourselves up for success. We also don't want anyone to believe that that child is a bad kid. They're not doing this on purpose. There's usually some sort of reason why that child can't tolerate it. It never means that the family's unhealthy or that they don't have access to something. That's not usually the case either. Something is not wrong with this child. A lot of kiddos will have picky eating as really their only true thing that they need to work on. They're very communicative, they're learning well, they play well with other children, they have good social skills. This is just something that maybe they're extra sensitive to, and it's really that one thing that they need to work on. Um, it doesn't mean that families can't afford good food. Doesn't mean that they don't have a good restaurant or good grocery store to shop at in their neighborhood. A lot of times this happens in very affluent families, and it just is one of those things that we need to continue to expose the child and kind of tease out what's going on. And then sometimes people will assume that the child is running the show in the family. And sometimes that happens, but it's not always true. We can have very assertive, very autonomous parents that do try really hard and the kiddo is still struggling. So we just want to demystify a lot of these things about the child who is a picky eater. And then there are a lot of mixed myths about how you should fix it when you look for advice. People will say that kids shouldn't be touching their food, kids shouldn't be playing with their food. They need to just eat it. You need to tell them the number of bites they need to eat and tell them they have to eat it before they can go outside or play with friends or have their screen time. That doesn't always work for these kiddos that don't have the skills. And that table manners should be taught early. Sometimes we do play with our food in therapy, and sometimes that's the best way to go about getting our hands messy and be more comfortable with the food. Maybe building a tower with it, and then you might see a kiddo eating a bite with their fingers, and that's okay. We also want to notice that kids don't always have to stay at the table to clean their plate anymore. I think when we were young, a lot of parents and grandparents would make us do that. We would sit and clean our plate. But it's not always teaching the best hunger rhythms or autonomy over our food that we can and in fact decide when we feel hungry and when and how much we eat. And you'll see later in when we talk about parent roles and child roles that that's a really important one, that the kid is in charge of if and when they eat. And then a lot of times people will say that if your kiddo drinks a lot of milk or just fill them up with whole milk, it'll be fine. That's not always true either. So we want to develop some very happy, healthy eating habits that aren't overconsumption of milk to make sure that we have all the good nutrients and colorful foods that our bodies need to function. So when does picky eating become problematic? And this is a really good list, a general list of things to kind of fall back on, because picky eating can be a little subjective and it changes over time very frequently based on environment and context and people we're with and circumstance. So these are some general rules of thumb for persisting problems. So if your child is pretty consistently eating 20 foods or less, or we're missing or deleting an entire food group, such as we can't eat any fruits or vegetables, we can't eat any protein at all. And that includes like no nut butters, no chicken nuggets, no anything like that. Or if we eat foods that we frequently binge on and then we delete them from our diet altogether. So if we really, really love spaghetti and we want to have it all the time, but then all of a sudden one day we just can't have that food anymore. That we call that a food jag. That would be an indicator of concern, not always the biggest indicator, but it is an indicator of concern if they're dropping foods pretty frequently. Um, and then if our child doesn't eat enough volume for age, and we'll talk about later some resources for where to find this appropriate volume for their age. And then some secondary indicators, if we're eating different foods than the family, causing some pretty significant stress on the family, causing the parents to have to make multiple different kinds of meals for every person sitting down at the table. If we're unable to tolerate a new food on our plate without significant distress, meaning like running away, fear, tears, really like disheartening behavior, feeling like we're kind of making a lot of demands or a lot of coaxing is happening, then that may be an issue as well. And then there's also some significant fear or phobias that kiddos have that when you place something on the table, it it just causes a panic. And if you feel like your child is having some significant anxiety, fear, phobias, or is terrified of a food, then that is another indicator of a concern. Now we have another list here of when it's just typical picky eating, because that sometimes can happen and that sometimes doesn't always indicate a need for intervention. And your child just may be on the pickier end, and it's something that we can kind of work on at home. And so when is this? When you have more than 20 foods consumed. And that on number, I often will tell my families that it can be two different kinds of pizza. It could be pepperoni pizza and it could be cheese pizza. And that's two different kinds of foods because we're getting that pepperoni, that protein on our pizza. That counts as a different kind of a food. So if you have a handful of foods, then that's a really good thing. If we can eat at least two colors from every food group is a pretty good indicator of that we're kind of okay. We have enough to work from because we're getting different nutrients in those different colors in every food group. And then if we can rotate between our preferred foods, if we are pretty good about, mom gets to decide what we have for breakfast and it's oatmeal, and then what we have for lunch, it's a sandwich, and then what we have for dinner, maybe some mac and cheese. We can kind of rotate between those foods without having to have some significant anxiety for what we're doing for dinner. And especially if they're eating enough volume. So some kiddos will eat a good amount to sustain their growth curve and others won't. And if they are sustaining their growth curve and they're staying right on that nice line, for the most part, then sometimes we're not that concerned. It's just something that we'll work on over time. And then we don't expect every child to eat exactly what the parent is eating, but maybe we're taking a meal like a taco night and we're separating those foods and making some modifications because your child doesn't like when their foods touch, or they don't like multisensory foods, such as eating a tortilla and ground beef and cheese and sour cream all at the same time. Those all have a lot of different flavors and a lot of different feels in the mouth. So we may take a separated plate, put our meat in one area, our lettuce on the other area, our tortillas on the side, and we may have a little cheese. And that child is participating in taco night, but it's okay that they're not having a taco. And that is a good indicator that it's just simple picky eating. These kiddos usually tolerate a new food that's placed on their plate or nearby them, maybe with some mild complaining, maybe with some noticing that you did that, but not necessarily a huge meltdown or tantrum. And then it's simply just picky eating if it's not affecting their participation in daily functioning. So that means they can go to school and they can probably find something to eat, or you can pack for them with some accommodations, and that's okay. They can participate in restaurants without distress. They can go to birthday parties and find maybe something to get them by. If they aren't a huge fan of pizza, that's okay, but they eat the cheese and crackers and then had some dessert. And then that's kind of getting them by, and then they aren't super embarrassed about the way that they eat in front of others. So if it's not affecting their daily functioning and it's not causing significant stress to the parents, then it may just be simple picky eating and something we're going to work on over time. Now, we can't talk about picky eating without talking about pediatric feeding disorder. So sometimes it does get to a point where we feel like there may be something else going on. There are a lot of different eating disorders now that are kind of newer in the diagnostic criteria nowadays. And the two that are pretty hot topics we're going to talk about today are pediatric feeding disorder, which is what you're seeing here, and then ARFID, which is what you'll see on the next slide. And so pediatric feeding disorder is classified as impaired oral intake that's not age appropriate. and is associated with some type of medical, nutritional, feeding skill, or psychological dysfunction. So we're not meeting our nutritional needs or we're not meeting our intake needs because of some reason of these four that you see on the screen in this diagram. Pediatric feeding disorder affects 1 in 37 children under the age of 5. And so a lot of times these kiddos come from complex medical situations. They may be preemies, they may have had surgery, they may have had some type of cardiac issue going on. They may have simply had an oral motor feeding delay, which caused a lot of gagging or vomiting or some lingering oral motor skills, which means that they can't control the food in their mouth and they can't safely swallow it. Um, or they may have some type of nutritional deficiency that's causing difficulty with feeding. This can also be associated with anxiety or some psychosocial aspect as well that impacts their ability to have appropriate oral intake. And the second diagnosis that we're going to talk about is ARFID. This is called Avoidant Restrictive Food Intake Disorder. And as you can see, it's not the same as anorexia nervosa, it's not the same as bulimia, and it's not the same as binge eating disorder. The other eating disorders account for this green portion in this circle, and ARFID is one of those eating disorders. So this eating disorder is also fairly new in the DSM, but we're seeing it quite a bit in the therapy world. It's defined as persistent food avoidance or restriction causing one of the following: nutrient deficiency, weight loss, dependence on tube feeding, or psychosocial impairment. And these eaters are more extremely selective. They often have very little feelings of hunger and poor interoception, meaning they don't feel their body as well as others. They may have very little interest in eating or feel like the feeling of hunger is actually more appealing to them than the feeling of eating. They don't have fear of weight gain, so it's different than your traditional eating disorders that we're used to understanding or seeing. They have more fear of the negative experience, and that can be that it feels so uncomfortable in their mouth. They are scared that they're going to choke. They're scared that they may have pain after they eat, maybe in their belly if they're used to having indigestion issues. And then this can cause some really significant distress. So these kiddos with ARFID are more likely to have some obsessive compulsive behaviors around food. They're more likely to have ADHD and they're more likely to have anxiety. Um, and so, how do I prevent food challenges early on? You have this perfect little infant that you just want to protect from all these feeding challenges, whether it be just typical picky eating in general, or some of these more significant diagnoses down the road that we just mentioned. And any of these strategies will help set you up for success for preventing some of those things. And I think this is the biggest question I get from new parents: is how do I set them up for success? And so the first thing is to establish a routine very early. We want to pay attention to any recommendations that you've been given, the handouts, the lists, the books that are out there on how to start solids, even some of your social media accounts that are healthy and positive that have been recommended to you. Obviously, make sure that you're kind of verifying that information and that it's true and valid with your pediatrician. But we want to make sure that we're introducing solids or purees to your child based on their skill level and when they're ready for it. So usually the pediatrician will clear the baby once they're sitting around 6 months to try some solid foods. You can ask, kind of what their recommendation is on whether or not you start with handheld solids or whether or not you start with purees, and it kind of just depends on your preferences and on your baby's skill level and muscle tone and how strong and interested they are. It's also important for that child to have a regular meal schedule. So at first, we may start off with one meal at a time, progressing to those three meals and two snacks when they get to the age of 12 months to really regulate their hunger cues. It's important that they're not grazing or continuing to eat every 3 hours as they did when they were infants. And so that we can kind of regulate our hunger cues and our hormones develop on time so that we know when we're hungry and when we're full. And that structure is really important to that. And it's your job as a parent to kind of follow through with that mealtime structure. If we need some help based on volume recommendations, as I said before, this is a really good website. It's the American Academy of Pediatrics, and they list out by age how much your child should be consuming based on their age and their weight. And so that's a really good trusted reference for you to look up. We want to avoid snacking, as I said before, kind of a curbs the appetite. Make sure those snacks are nice and healthy and lower calories, so that we can have a higher calorie meal for our meal. And then we want to make sure that we're discouraging our child wandering around the house while eating because they're very distracted while they're eating. Again, not paying attention to how their belly is feeling when they eat. And as parents, we want to make sure that our baby's getting adequate sleep at night to regulate those hormones that we need to send those messages to our brain to tell us that we are hungry and full. And then getting started, we gave you some tips here to kind of look through. You want to introduce a variety of foods from the beginning. So um, make sure that if our baby just takes to one thing, that we're kind of gently exposing them to new flavors over time. You're obviously monitoring for allergic reactions, maybe starting with single ingredients, but as they're able to tolerate those things, that we're opening up their palate to many different flavors. And that can be in puree form, or if they're ready for solids, that can be in solid form. But we're just offering a variety of things across all the food groups. And we're offering it as age appropriate as we can based on texture and that skill level of the child. So they're going to show you, they're going to take the lead, they're going to show you kind of what their ability is. And then we're going to try to modify the texture based on their skill or their age level. So by 8 months, we know that it's okay for a baby to have something the size of a puff in our little cheek. So we learn that up and down chewing movement. So we want to give them the just right challenge for learning a new skill, just as we would when our kiddos start walking. We allow them access to learning how to walk and to learning that the environment is safe. We want to do that and set them up for success with foods as well. So giving them access, but it's our job to know where they should be and if we need help with that, finding the right professionals that can guide us to let us know. We want to make sure that we change our brands and our packages all the time so our kiddos aren't getting so used to doing one thing at a time or only experiencing one certain visual of a food so that they don't know that it can come from a different box or a different package. So we're kind of not causing some resistance or rigidity with foods. We want to make sure that we close the kitchen between meals and snacks. Again, that kind of limits the amount of grazing that we're doing. We want to turn off the TV when we're eating because that's very distracting and multisensory, and so sometimes it can limit those signals we get from our body and that help us process food or experience a new flavor even. We want to make sure that we're not becoming a short order cook, that we're not giving one child, say we have three kiddos at the table, we're not giving one kid exactly what they asked for and making three, maybe four different meals for dinner. We want to introduce familiar family foods. This is always encouraged. We don't want to limit the amount of like spice that we use or temperature differences that we have or flavor varieties or different cultural foods that your family experiences. We want to make sure that they are well versed in all of those things pretty early on so that it's not hard to learn later in life. And then we want to create a safe and calming feeding environment for our family. So I always give the example of sometimes you walk in my dining room and my dining room's full of Amazon packages or mail or bags or suitcases left over from my husband's business trip. And if I ever expected my family to go eat in there, it'd be very, very overwhelming. So before dinner, I clear the table, I get everything set up, I make sure that the TV's off, the dog is kind of taken care of, and we can all sit down in a calming place. And that's always not necessarily an option for some families, but for the most part, making a calm environment for eating is important for our bodies to feel less stressed. We can never eat when we're stressed. So we want to make sure that it's not cluttered or overstimulating where we go to eat. And then this is easier said than done with some families that have lots of things going on, different work schedules, sports, and the busy chaos of what our current society is right now. But we want to prioritize family dinner whenever we can, because it provides so much opportunity for our children to learn through modeling. When they see their siblings do it, when they see their family do it over and over, it makes them feel safe, and so they want to do what we do. They have those modeling neurons in their brain that they want, or their mirror neurons that they want to mirror what you're doing. And so if they see you eating chicken, they might try to grab it off your plate and get it. And so those opportunities are so important for positive experience. And then we want to consider our equipment. Do we have a comfy high chair? Do we have an age appropriate cup that we're using? Or are we asking a little bit too much? Is it too hard for the child? Do we need to modify that cup so they can get the food out easier? Do we need to provide utensils, or do we need to provide a different utensil based on the size of their mouth, or what is comfortable for them in their mouth? And then maybe your child who doesn't like foods to touch, we need a separated plate. So consider your equipment, consider your kiddos' needs, and again, when you need help with that, asking the appropriate professionals. Um, and then encourage, allow, and model play with food to get messy, to really explore with our hands, to smell it, to feel it, and see this kiddo in this picture to really get into it, because he's experiencing all of those sensory properties right there just by being a mess. He's got the touch, he's got the smell, he's got the flavor, and he really is having fun. He's happy about it. And this is what a happy, positive mealtime should look like with your kiddo that's starting solids. It should be a mess. And it's difficult, I think, sometimes when we have a hard time with ourselves being messy. But if we can anticipate this in advance and pulling out a tarp, or making sure that we have a shirt off, like this kiddo right here in this picture, and then it's bath time afterwards. Getting ourselves used to tolerating mess will help get our child used to tolerating mess. And now, we always have to have our own mindset in the idea that it can take 10 plus times to try a food to determine whether or not a child likes it. Sometimes even 20 times, because like we mentioned before, we need those nerves in the brain to be stimulated over and over and over to process the food and say, I remember this. Yeah, this is whatever food that mom made for dinner a couple weeks ago, and remember what it is and what that flavor is and how we move it around in our mouth. And don't stop just because they throw it on the floor every time, or just because they say no. We're going to continue to put maybe one or two little pieces on their tray every time we make that food, just so that they get used to it and they are offered that opportunity. And then, sometimes we do everything right. Sometimes we read all the books. Sometimes we set everything up just right. We consult our doctor and our friends and everybody around us to help us with our child. And they're picky anyway. And this can happen. You can do all the right things. It's not your fault. So what do we do at that time? We have to remember that most kiddos go through a picky phase between the ages of 2 and 4. This is when our brain develops the desire for autonomy and control, and eating and using the restroom are pretty much the only thing that toddlers can control at this time, and they will exert their dominance. If you've ever been around a toddler, you know this. They will exert their dominance over food, and they may decide to just kind of test the water and find out what happens if I decide not to eat. And then they're going to learn the natural consequence of that. Hopefully, they're going to feel hungry eventually, and then they'll come back to it. And it's pretty normal. This whole picky stage is also sometimes a protective impulse from a human, because right around this age, when we do develop more autonomy, we're exploring and we're going out in the wild without our parents. Sometimes we're going to preschool, we're having play dates, we're doing things that are out of our comfort zone, and our brain is trying to protect us from those new things so that we can prevent allergies, so that we can prevent negative experience and things like that. So that it is kind of a protective impulse when kiddos do refuse new things because they don't want to have a noxious stimulus. And that's okay. But once they learn over time that it's safe, they'll start accepting it. Um, Again, once they do start accepting it, then they get those positive pathways built in their brain, and then they'll start to learn about it more, they'll start to enjoy it more. And so they don't just eat, they do have to really learn about things like it's a spider on their plate. You offer them something new that they've never seen, they have to explore it, figure it out, and have multiple positive experiences with it before you can expect them to chew and swallow sometimes. And what is the sensory system's role with that? So a lot of talk about kiddos, we'll talk about sensory world, and it's just a very confusing word and sometimes wrapped in with other diagnoses. But we have to remember that we all have sensory systems. Everyone's born with a sensory nervous system. We have the feeling of being able to tell when our body is moving, which is that vestibular sense, when we're being touched, when we can hear something, when we see something, and what that looks like. The proprioceptive sense is the body's muscle and joints knowing where your body is in space. We have a gustatory sense for taste, and we have an olfactory sense for smell. And we all have experienced these senses in different ways. It's just like a pain reflex or a pain response. Some people can tolerate pain at a higher level than other people can. And so, similarly with food, some people can tolerate high texture, high flavor, and some people can't. And all of these aspects are incorporated into your mealtime. And we need to feel calm, and we need to feel like we're not overstimulated while we eat so that we can process those senses in a healthy way. So when you're finding out that your kiddo is a picky eater and they may have different sensory systems than the rest of your family, how should we approach them? So first of all, we can talk and we can discuss, and we can give them a lot of basic food education that is tailored to their age. And so there's all kinds of things out there to do that. So the first job you can really do as a parent is take them to the grocery store with you. Have them label food. They may not even understand how many foods are out there until they really go shopping with you. And I think after COVID and after the convenience of all these online shopping things, we don't always get our kiddos to the store because it is easier to just put it in a shopping cart online and go about our way, pick it up later. And so a lot of our kiddos don't get that experience to say, hey, mom, I want to try that red thing over there. And it may just be like a new kind of an apple. And so they don't have the opportunity to be said yes to. So we can also incorporate books, and we can incorporate games that have food in them. We can incorporate toys. Kiddos are motivated by play and by learning. And so The Very Hungry Caterpillar is this book that's on this slide. It is such a good one for teaching different fruits, different veggies, and just a cute way to incorporate maybe like a bite per page or something like that. We have a lot of different tools such as coloring pages for kiddos that they can color in the rainbow, and they can learn about different jobs that different colors of foods have. So green foods fight the germs. The red foods might be good for our heart. The orange foods are good for our eyes. And so we have to talk to kids at their level and get them motivated to eat. What should we do at mealtime? So here's some rules of thumb. We don't want to sit them down and make the meal stressful. And we talked about that a little bit before. We have to feel comfy to be able to eat. So don't use mealtime to talk about negative aspects of their school day or the bad grade they got in their test, or the fight that they had with their brother yesterday. Let's keep that mealtime light and positive, and you can talk about that later. We may want to do some things that encourage them to come to the table if that's hard for them. So we may want to incorporate some fun plates or things that are visually pleasing for them to come to the table, like this little construction plate that we have over here. It's not always foolproof. It's not going to get them to eat the food, but it may get them to come to the table and join you. And maybe they're smelling it and touching it and talking about it. Um, when making your child's plate, you want to make sure that they always have something that is preferred on their plate that they know that they can eat, so that they don't have that anxiety of, oh my gosh, everything's going to be so hard and so new. I don't even want to go to the table. So we put maybe their preferred food and then a little bit of something that we're eating kind of close and nearby. We want to keep that thing that we're trying to encourage a lot smaller than a normal portion, to really say, we know that this is overwhelming for you. You may not eat it all, but we're going to do something with it. Maybe we can put it on our head. Maybe we can give it a kiss. Maybe we can throw it in the garbage can and get them to touch it. But there's something there that's new, and we're expecting something different of them. We want to make sure that we're modeling that we eat all of the foods that we want our kids to eat, so that we don't make broccoli and say, you have to eat 3 bites of broccoli, but mom doesn't like broccoli, so I have something different on my plate. So make sure that that's not happening as well. Talk about those foods and challenge the child, and maybe ask them, what would happen if you just put your tooth in it? That's no big deal. We're not asking you to take a bite, but what would happen if your teeth mark went into it? Would it be crunchy? Would it be soft? Who can crunch it louder? So those kind of questions are always really helpful as well. And then if they can't eat the food, that's okay. Just kind of know that we're working towards eating the food, but count every single opportunity to experience a sensation about that food as a success, and then praise them for that. And move on to your way, move on to that next meal. So what happens when your kiddo has a lot of behaviors at the table? You can't even work through getting to doing some of those things that we just talked about, because there are so many behaviors. Um, and what we've learned through the research is that using a diplomatic feeding style is the best approach. So we don't want to be too authoritative with our children. We don't want to be telling them exactly what to do or else, kind of a thing. We want to use some loving limits, using firm language such as, first we're going to eat and then you can go play, or first we're going to sit at the table and then you can get up. It's time for dinner, not what are we or when are you going to eat? That's a different permissive style. That's also not the best way to approach it. So we don't want to be too lax on our kiddos either. We want to use that firm language and let them know it's time for dinner. Let them know mom cooked for you. We're sitting together, and that's the expectation. But you may not have to eat it, and that's okay. But we want to also limit our choices. We can provide some choices for kiddos that need to feel in control, but limits them to a couple different things. So a good example would be, if you made baked chicken that night, do you want ranch with your chicken or do you want ketchup? It still indicates that they are going to have chicken for dinner, but they can choose the dip. Sometimes I do this with my kiddos if they don't have the option of choosing a dip, or they were at a restaurant or something. Do you want to sit next to dad or do you want to sit next to mom? And they can make that choice and feel a little bit more in control. We want to avoid reverse psychology. So you don't want to say like, oh, you can't do that. You can't eat that blueberry, because that can encourage them to actually believe it sometimes. And then keeping all foods equivalent. So we don't want to say like, eat all your chicken and then you can have your ice cream, because that indicates that that ice cream is something that they have to work for. And so we want to make sure that they know that all foods are created equal. Some foods are sometimes foods because they have too much sugar or they might hurt our teeth or something like that. And some foods are all the time foods, like an apple that has a lot of health benefits. We can use positive reinforcement. We can use token reinforcement, meaning like we have a visual for the child that, if they sit at the table for a certain X amount of minutes, then they get a check mark on a box that they completed the task. We can also use visual timers. So we can say, you're going to come to the table with mom and dad for dinner time, and dinner will be 20 minutes. We're setting a timer. When the 20 minutes is up, you can be excused, something like that. So very diplomatic feeding style, meaning that you create the boundaries and your child kind of works within those boundaries with loving limits. You want to maintain your roles. And your roles are that the parent decides when and what the family is having for dinner or for the meal, and that you're making sure that you abide by that. So you're closing down that kitchen in between. You may take the plate and put it up in the kitchen because it's now time to go outside. But if your kiddo's hungry again, they can come back when it's snack, and they can eat that plate, and we can play outside and then come back later to it. You also want to make sure that that child is following their role as well, and that you're allowing them to follow their role. So when you put food in front of them, they do get to decide if they eat it and how much of it they eat, because they are the owners of their body and they're the owners of their hunger cues. So they are going to regulate those things on their own. And if they don't, they're learning how to. And so it's important that they experience hunger, and it's important that they experience situations where they learn that, oh man, I chose that choice and then I felt this way later. And so that teaches them then that next time when it's available, maybe I should try to eat something. And then if they refuse, you can just move on, and that's okay. That was their choice. We do want to respect their boundaries. Force feeding is definitely not recommended, just based on longevity. It may work in the short term. You may be able to get your child to eat really quickly before you're going to go do something, and then you can make sure that they're happy and fed. But in the long term, they may feel more pressured, or they may feel like they're not in control of that if and how much. And so that can cause some difficulties down the line and become associated with those other types of eating disorders that we have said in the past, or maybe some type of just negative mental health aspect in general. And then using that low pressure environment for kids to explore new foods can help decrease their anxiety or their fear of food. So these cute little pictures are just showing some food art. So getting kids incorporated to touching foods and exploring those sensory properties again is so important. And you can do that through play with food, or food art in general is a really great way to incorporate kiddos. Um, and then honor their words. You can use mantras such as, I understand that this is hard. I understand you said no. We're going to leave it on the table. And then you can teach your child and your significant others, your family members, or other feeders around you that if somebody thinks something is yummy or good, we're not going to yuck it for them. We're not going to say, oh, gross, you like mushrooms? That makes them feel like something's wrong with them. So we're not going to yuck another person's yum, can be a good rule of thumb for your household or for your caregivers. And then what do we do when a child will eat or won't eat something that they used to eat? This is called a food jag. And this often happens when you eat something over and over and over and over, and then you don't want it anymore because it makes you sick. And this can happen with me sometimes with Chipotle. I love it every single day. And then maybe on like the 7th or 8th day, I really don't want to eat that Chipotle bowl anymore. So it can sort of be kind of normal, but we want to make sure that it's not happening all the time. Um, and so in order to prevent this, the best thing to do is to rotate their preferred foods often. We don't want to feed them mac and cheese every single day for lunch, or the same sandwich every single day in their lunchbox, because one day they might come home and they may not want to eat that sandwich anymore. So we can allow natural breaks from foods, trying to maybe incorporate something that's similar but different. If they love a turkey sandwich, the next day maybe we're trying a ham sandwich. It's a similar texture, it's a similar flavor, but a little bit different. And then how do you know when you do need more help? If you're trying all these things, you're following all the strategies, but you really can't seem to figure it out, um, or you're experiencing any of these different symptoms on the screen that are unrelated to picky eating, such as poor posturing during feeding. So kiddo can't really quite sit up well in their high chair. Um, they cough a lot, they gag a lot, they choke a lot. They may have upper respiratory illnesses all the time that we're questioning their integrity of their swallow. Do they have poor attention for mealtime or just general lack of interest in food altogether? Trouble chewing, spitting things out frequently, maybe could be related to trouble chewing. Um, do they take way too long to eat? So, more than the average time for a family or a child to sit at the table to chew and swallow. And then the poor weight gain, which would usually be flagged by a pediatrician. But if that's happening, we want to make sure that we are seeking more help, asking our doctor, looking for feeding specialists for an or an occupational therapist or speech therapist who knows a lot about feeding to treat the problem. And this slide is telling you kind of like what we can offer as occupational therapists for the picky eater. And it's not limited to occupational therapists, but that's my specialty. So this is what I do look at when I am assessing a child that is a picky eater. We look at their sensory integration. We see how we can help them tolerate those noxious senses over time. We use play-based exposure, like we talked about before. Kids love, love, love play. So we will incorporate and create activities and intentionally set them up for success through play. We look at the movement of their mouth and their oral motor skills. We see how we can strengthen it. Can we offer some food exercise? Can we offer some endurance exercise? Can we offer some core control exercise that can help us sit up and support those oral motor skills a little bit better? And then we practice that movement in the feeding. We do a lot of times create feeding routines for families that have not necessarily had a great routine all along or have a hard time for some reason incorporating a routine into their setting. And then we collaborate with all other professionals as well in that child's team and try to flag if we need someone else's support, such as a dietitian or a GI or someone to help us with their reflux, something like that. So we do all of those things when we do look at an assessment of a picky eater. And this slide, I'm just giving you guys some educational resources that you can look to. If you feel like you have a picky eater on your hands, the book called Try New Foods is a workbook. It's a really nice workbook that has you kind of go through your own feeding history and your own cultural experiences and how you parent your child and think about what could be influencing your child's mealtime behavior in a journal style, which is nice for some of those people that like to do homework. And then Baby Led Weaning book is just a nice book to read through your pediatrician when you're getting started with solids. We'll recommend Baby Led Weaning style quite a bit, but often it's you have to do the education first. You have to read about it and understand what a safe size solid is for my baby's age or their skill level. And so this is a nice book to really kind of get you started and think about how you're going to present those things before you even start solids with your child. And then Just Take a Bite is a really nice one as well to kind of talk about how our sensory systems can be very challenging and different. And this is a good one to try to understand your child's sensory system and why they may be refusing when mealtime should seem so easy. And then we have the website again for volume recommendations, the American Academy of Pediatrics. So that is a nice resource as well. Here are my references, and I just want to thank you guys for logging on to listen to this lecture today. We are, again, Therapy Services, Cleveland Clinic. Please reach out to your pediatrician and ask for a referral if you feel like we can help your child.